Welcome to WeCare4's podcast series for caregivers. WeCare4 is a community, platform, and portfolio of resources. WeCare4's purpose is helping those who care for others. Today, we are going to discuss the various Medicare choices that must be made by or for those who are eligible. Understanding Medicare can be a daunting task. However, my guest today, Mary Ann Larkin, can help you understand the basics of Medicare, provide some pros and cons with Medicare Advantage, which we see advertised so much, and direct you to where you can find help and available resources. You can find some of Mary Ann's material supporting the points that she will be covering today on our website, www.WeCare4.com, in the forum section. Mary Ann is a retired information analyst. She has dedicated over 20 years of volunteering. She's currently a volunteer as a health insurance information counseling and assistance program certified counselor with the New York Westchester County Department of Senior Program and Services. This service that Mary Ann is working for is a free service with the goal of providing education and counseling around Medicare and other senior benefits. So Mary Ann, thank you so much for joining us today. And I'm hoping that this will help others, other caregivers and other people who are interested in Medicare. So if you could, please briefly describe Medicare program parts A, B, C, and D, and what are the key decisions that one has to make when choosing Medicare options?
Well, thank you, Carol. It's very nice to be here, and thank you for having me. Yes, I will try to give a brief and concise information on Medicare program. Medicare program is a federal program, and actually it is a federal and private partnership program. And Medicare is available to people 65 and older, those with disabilities, those with ALS, and also ESRD, that's end-stage renal disease. So what is Medicare parts all about? Part A and Part B are federal programs. I will briefly describe Part A and B. So Part A is hospital coverage for those who are an admitted inpatient. That is important because you have to be an inpatient and admitted to utilize the Part A benefits. If you are not an inpatient admitted at the hospital, for instance, if you are at the ER and you are there for even for more than a day, you are under observation. And that part of the coverage is provided by Part B, as in brown. And that only covers 80% of your Medicare costs, because that's what Medicare covers, is 80%, and you will have to pay the 20% out of pocket unless you purchase a separate Medigap or supplemental policy, which we will talk about in a little bit. So what does Part A cover? Part A covers all of the benefits, services that you use in the hospital when you are admitted as an inpatient. Part B covers all of the outpatient services, your medical doctors, your tests, your labs, your durable medical equipment. So anything outside the hospital as an outpatient is covered under Part B, and that is benefits is covered by 80% by Medicare. So those are Part A and Part B, and everybody receives those benefits when you're 65 and older, and the other categories as well. How do you enroll in Part A and Part B? You enroll not with Medicare, but you enroll with Social Security Administration. And the website is www.ssa.gov. But you do have to enroll in Part A and Part B at the time when you turn 65. However, if you do continue to work past 65, you can enroll in A, and depending on the size of your company, you will enroll in B. If you are 65 and continuing to work, and your company has employees of less than 20, you must also enroll in Part B. However, if your company is larger than 20 employees, you may postpone your Part B enrollment and wait until you are leaving your employment or retiring. I want to bring up the word COBRA at this point, because many times employers may offer the employee the option of getting COBRA. COBRA is a program where you can continue to have health insurance benefits from your employer, but for which you pay the full amount. It is not subsidized. Also, more importantly, COBRA is not creditable coverage. So when you turn 65, if you have had COBRA before 65, you must take Part B. But if you have COBRA after 65, you may keep your COBRA, which will be your supplemental or secondary insurance to your Medicare Part A and B. Just keep in mind that if you do not enroll at this period when you're eligible, there is late enrollment penalties. Very briefly, usually it's Part B, because that would have the penalty, because Part A, most people have 40 quarters or have worked for 10 years, and that Part A is free. But Part B, if you do not enroll when you're first eligible, the penalty is 10% every 12 months of the Part B premium for as long as you have Part B, meaning for the rest of your life. So it can be substantial. That's why it is important to enroll when you are first eligible.
It's a great point.
So the other point here is, of course, the premiums. The premiums for Part A is free if you work 40 quarters. For Part B, for 2024, is $174.70 per month. And that, if you are receiving Social Security, will be deducted from your Social Security check. If you are not receiving Social Security, you can be billed quarterly, or you can have arrangements to have it deducted from your accounts. Social Security is very flexible. They will take your money any way you can give them. So there is a deductible for Part B. It's an annual deductible, which is $240 for 2024. Now, there's another wrinkle here, and that is called IRMA. IRMA is income-related monthly adjusted amount. I will not go into the details of it. Just want you to know that there is such an item, and that if your income is above a certain level, you will be charged a surtax on top of your Part B premium. That is also true for program Part D, that also has an IRMA.
What is Part D?
Part D, I will touch Part D in a moment.
Sure.
I would like to cover the segment that is now going to be the Medigap and Medicare supplemental program, because it ties in with Part A and Part B. because Medicare pays only 80%. The 20% is out of your own pocket. Or if you would like to purchase a policy known as a Medigap or supplemental, those terms are interchangeable. You can purchase a policy from a private insurance company. And there are companies which are approved by CMS and the state to sell. So the information I'm providing is information for New York State as well as for Westchester only.
Mary Ann, tell them what CMS is.
CMS is Center for Medicare and Medicaid Services. That's the federal government which oversees all of our benefits, health benefits. They approve all of the plans that come into every year, and they set up policies governing all of these health benefit programs.
Thank you.
You're welcome. And then supplement Medigap and supplemental policy. It's a little complicated, but I'll try to be very brief and try to give you an idea. And I'll tell you where you can find more information on your own so that you can read up on it. Medigap policies are indicated by alphabets. They go from A, B, C, D, F, G, K, L, M, N. And these are the benefits which supplemental benefits for the benefits which CMS determines which are offered under Medicare. An example, it covers your hospital co-insurance, it covers your Part B co-insurance, it covers your skilled nursing facility, et cetera, et cetera. But not every plan, like A and B and so forth, cover the same benefits. However, the benefits which they cover are standardized. So for instance, if company Smith offers Plan F and company G, Charles offers Plan F, both of them, the plan benefits are the same. However, the premiums differ. They could charge different premiums for the same plan, but you're not going to get more benefits if you pay more.
So you have to shop.
Yes,
so
you do want to shop around. Just like if you're going to buy a bottle of Coke from Stop and Shop, you pay $2, and you go to ShopRite and you pay $1.50. The Coke is the same. But the price is different. So that's where the Medigap policy makes a big difference.
And that's where the insurance companies come in, like Aetna, United Healthcare, and that's one of the reasons why we talk to people like you, because you can help with this Medigap plan. And this covers the 20% that the government doesn't cover, correct?
That's right. It covers the 20%, which traditional Medicare does not cover. So that's a brief insight about Medigap and supplemental policies. Now let's take a look at Part D, because we want to have a comprehensive package, which is your Part A, your Part B, and now we covered 20%, which is a supplement. And then you need a prescription drug plan, because traditional Medicare does not include drug plans. So Part D is also offered by private insurance companies, and you need a separate policy for the Part D. Part D plans are also offered by the same companies which offer the next group, which we're going to be discussing, which are the Medicare Advantage plans. They could be Aetna, Humana, United Healthcare, Blue Cross, et cetera, et cetera. And each company may offer more than one prescription drug plans. They may call them Aetna Plus, they may call them Aetna Value. So you have to beware of which one you're getting. The Part D plans, each one of them has a formulary. Formulary is a list of drugs which will tell you those are the drugs they cover. They are by law required to offer 2 drugs per class. And most of the drugs that people generally take, are covered. They may not be the same drugs for each plan, but they are the same class. So people often ask, what if I get a drug later on and it's not on my original plan? I don't think that may be a problem, because as I said, they have to offer 2 drugs per class, and then the choice will be there for you.
Maybe some of the new drugs that come out may not be on the plan, though.
The newer drugs, which most people are on television,
Yep.
may not be, yes. And also clinical trial drugs are not on the plan. Drugs plans also, the drugs can be in tiers. They can go from 1, I think now it's up to 5. The lower the tier, the least expensive they are. And the lower tier drugs are generally your generic drugs. And they are also step therapy. A drug plan may ask you to try a lower cost drug for what you've been prescribed and see if that works. And if that works, then that's the drug they're going to offer you. But if you cannot take that drug, you can have your doctor provide evidence for an exceptions. There's also quantity limits. That means that the plan may limit only, for instance, 30 pills per month for this particular drug.
Correct.
So that's your comprehensive package under traditional Medicare. Now, there's another way of receiving Medicare benefits, which is the Medicare Advantage plans. Those are the ones
I can't wait for you to tell us the pros and cons of Medicare Advantage, because all we do is we see a ton of that information on a TV.
Exactly.
And I know that the government has been cracking down on some of that advertisement. So I'll let you describe what's going on there, because everybody's going, oh, I want a Medicare Advantage program, but it's not all that it's cracked up to be.
Yes, you're absolutely right. They do have, advantages. People do use them and they stay with them. So it's really very personal depends on your health condition, depends on your financial conditions, and depending on the fact that you can deal with the various steps that are required. So you can get your Medicare benefits through a Medicare Advantage plans. However, you must have enrolled in A and B in order to enroll into a Medicare Advantage plans. Medicare Advantage plans has 2 levels. One is called the HMO, Health Maintenance Organizations, and the second level is the PPO, the Preferred Provider Organizations. Briefly, HMO requires network doctors, hospitals, pharmacies, referrals. Some of them don't, but most of them do. Prior authorizations. So they are not flexible. In other words, HMOs, you must use the network doctors, etc., in order to get your benefits covered. PPO also uses network doctors, hospitals, pharmacies. However, PPO allows you to go outside the network to see another doctor who accepts your insurance but do not belong to the network. You will be paying more for that service. PPOs do not have referrals, but they do have prior authorizations. What are prior authorizations? Prior authorizations is when you are prescribed a test, you have to go through the plan to get authorized to take that test. However, this is not on you. It's really on the provider. The provider has a system that they have to go through to request the prior authorization for you. So you don't really have to do anything, but it's a provider who has to do the work. It's limited, both HMO and PPO are limited to regions. HMO is very limited. You have to be in that particular area in order to utilize that plan. PPOs, however, some of them have been extending their areas of coverage. There are plans which are national now. So if you are traveling to other parts of the country, you may want to check and make sure the plan covers the areas, or if it's national, that you can utilize while you're outside your area. Both of them have maximum out-of-pocket, which is the amount each year they set up that you can spend. And once you reach that amount, the plan covers everything. How do you enroll in Medicare Advantage plans? You enroll either with Medicare, or you can enroll in with the plan. Some plans have premiums and deductibles. So if you hear someone says, I have a zero premium plan, that's very possible they do. But they will also have a deductible as well. So both of them have those type of coverages.
Mary Ann, what about drug coverage?
Drug coverage is embedded into the Medicare Advantage plans. In other words, that's a great question, thank you. Because it is, Medicare Advantage plan is really a basket of everything. It includes your A, your B, your drug plan, and actually includes your supplemental, because you don't need a supplemental. However, you do have copays when you go to see a provider. Each time you go to a provider, you have to pay amounts of either $35 or up, or $25 or up. So you do have a copay each time. So that's why you do not need a supplement, because you pay upfront there.
Okay, yeah. Mm-hmm.
Medicare Advantage premiums depends on the plan. So each plan sets their own premium, their own deductibles. And inpatient, if you are in the hospital, they charge you they could charge you a certain amount per day for 1 day, 1 to 5. Some plans have certain amount per day, 1 to 7. So it just depends on the plan. They have the free flexibility to set up their algorithms, how they ever want to do it. And not every plan is the same. So you do have to look at all the details. Now, shall we do the pros and cons?
Please do.
So the pros and the cons are, take traditional Medicare, you have more choices. It's accepted by most providers. You do not need referrals. You do not need authorizations. If you decide in the morning you have something, you want to go see Dr. Smith, you don't have to worry whether he's in the network or not. You just can make an appointment. And you can travel anywhere in the United States and utilize the facility or provider who accepts Medicare. Keep in mind that for emergency purposes, either traditional Medicare and Medicare Advantage plans, you're covered for emergency. That there's no dispute about that at all. For the cons on traditional Medicare is that it does cost quite a bit, because the cost comes not really from your Part A and Part B premium. It might if you have IRMA, but it really comes from the Medigap policy premium, because that is quite expensive. You do not have a Part D embedded with your Medicare Advantage plans. Traditional Medicare only pays Part 80%. So you need that Medigap and supplemental plans. There is no maximum out-of-pocket, no cap. So you can go into all kinds of high dollar amounts. and there are no additional benefits.
Right. You don't get vision, you don't get dental with traditional
You
Medicare.
do not get vision, you do not get dental, you do not get a lot of the other
Hearing
benefits,
aids.
supposedly, which you're seeing on television that sounds so wonderful, and they are if you qualify. So what about Medicare Advantage plans? What are the pros and cons there? The pros is low premiums or zero premiums. You have an annual maximum cap. It's Part D, your prescription drug plans are included in there. However, you cannot choose your Part D plan. You have whatever plan, health plan you pick, that's the Part D plan. You must stay with it.
So you have to be careful that they cover the drugs that you use in that Medicare Advantage program.
Absolutely, yes.
You get messed up.
Yeah, you will know that because Medicare Advantage plans and drug plans, when you look for them, they are driven by your drugs.
Drugs, okay.
So you will know that whether the plans that come up cover your drugs or not. Although it may not cover every drug, but it will tell you if it covers 1 out of 4 or you cover 4 out of 4 drugs. So it's very clear. It does tell you that.
Okay.
Does not mean that it will cover every drug. It does not actually mean that. It does, but it will tell you what it's covered. Yes. It has extra benefits. These benefits, generally speaking, for a long time, ever since Medicare Advantage plans have existed, I believe, they've always included hearing, dental, and vision. However, they do sound wonderful, but the hearing, vision, and dental are routine. It's just a year annual checkup. It doesn't have cavity coverage. It doesn't have a gum periodontal coverage. It doesn't have crown coverage. So it's just a checkup. It's just a checkup, right?
Oh, and sometimes it's just one checkup a year, not 2.
Oh, absolutely. It's only one, limited. However, in recent years, some plans have started to expand those coverages. And they are, I call them riders because in insurance industry, they are what they are called. They are called riders. It's a rider attached to a policy where you pay extra premium for extra coverages. So many of these plans have now started to offer
riders,
crowns, cavities, extractions. Some plans even do offer this now with no extra premium. However, you have to be aware of what they're doing. They may say, but there's no extra premium, we're offering this and this and this, but there may be limitations as to 1 crown every 2 years or some such thing. You do have to, in other words, read the fine print.
I was going to say, you have to read the fine print, otherwise you're buying. And then the hearing aids, some cover, some don't.
Right.
And the vision.
Exactly.
As well.
And vision, yes, exactly. Glasses, and everything. But glasses are covered after cataract surgery. So you get one pair of free glasses after cataract surgery.
Probably reading glasses that you get to take, you can buy.
It is reading glasses, yes. Some of the plans, Medicare Advantage plans, are offering these extra benefits like flex cards, even Part B refund on your Social Security, your OTC cards where you can spend on a certain amount of money. You can spend on anything you want, but you do have to be careful because that's not everybody gets it. Now I see the ads now say you do have to call and find out with your zip code to see if you're covered. So that's one of the things that have changed.
I forgot it's regional. Yep.
Regional, right, exactly. The cons of Medicare Advantage plans: copays, network, utilization, prior authorizations. You do not get a choice of your Part D prescription drugs. Your limited ability to return to your original Medicare. That is due because you need to buy a Medigap. That is not always the case across the country. There are set amounts for certain treatments, like dialysis. They may say they pay 20% of the cost. So those are the fine prints that you need to be aware of, and you cannot buy a Medigap supplement. They're not allowed. You can't be sold one either.
So if you find out that you need dialysis or you need some chemotherapy that's not particularly covered in the Medicare Advantage plan that you want, then you're really messed up. I remember when we went to the meeting that we did in Burke, one of the women had asked a question regarding the hospital. She didn't realize that the hospital in her neighborhood was out of network. So and she was like, so you mean I have to, all of the doctors that were covered were in another state, like a half hour away. So it was like, holy cow, what do I do now?
Yes, that can happen. You do have to be aware of where your doctors are and what networks they belong to, and utilize them within the network.
Yep. So I don't know if you have any other points on that, on the Medicare Advantage program. But I was wondering, there are many resources out there. And I mean, you provide in Westchester County through your organization help that people can call and come in and find out information. And I know that you mentioned libraries, and I know if people are good on the computer, they can go to Medicare.gov, and they can, and that I would say is getting much better over the years. They made it very easy for you to plug in your drugs, and it gives you all of the typical services. But it is daunting. I mean, it would be great if you can go to somebody like Mary Ann and say, hey, tell me what to do and how to do it. So, I mean, there are people out there that can help. So I'll let you talk a little bit about that.
All right, I'll be glad to. So there are services available. And I'm going to mention the one that's available in every county. That's called your local SHIP. That's SHIP, and that would be they're not always called the SHIP. So like in Connecticut, it's called Choices. The program is called Choices. In New York here, we're called HIICAP. So and I'm a volunteer of HIICAP.
HIICAP, yep.
So right. So, but local each county has their SHIP office. And Office of the Aging would be the place where you start if you don't know where your SHIP is. That's a very, very beneficial place to get assistance. And the other one would be Medicare. And if you have that handbook, Medicare and You book, which comes out every year and is sent to every Medicare benefit beneficiary, that is a wonderful reference tool for you to read up on the points that I've just been speaking about, and you can get the details and you can get some more insights into it. We do have local. I'm in Westchester, so we have local libraries, which we have set up programs through a nonprofit group that's called the Senior Benefits Individual Counseling Program.
That's Westchester, New York, right, Mary Ann?
That's Westchester, New York, right. Yeah. And they do have walk-in, one-on-one, and you can sit down with them and go over your situation. But I don't know whether that's relevant to, your listeners right now. Exactly.
Yeah, yes. It could be, just so that you know, I mean, libraries throughout the United States, some of them are the networks are really great. You might find in the library that's in your particular area, you can check and ask, and the librarian could point you in the right direction. Yes. I think in all of the if you were to look in Yellow Pages or even I don't have it on there now, but in WeCare4 in the marketplace, I will have resources that you can get to where you can find different agencies that can help you. But everywhere, and there's a ton of information out there. You just have to be aware that you can get the information. Medicare.gov, you should go to. It is an excellent resource. And they also can direct you to places in your area. It's a great website. So don't hesitate to go there. And there are people like Mary Ann that are around. Mary Ann, I just want to say, I don't know if you have any other parting comments.
I do.
Okay, I'll let you give your parting comments.
Okay, well, I just want to bring up one more program that is not part of the federal government program. It's really a state program. It's called, in New York, it's called EPIC, but in states, it's called State Pharmaceutical Assistance Program. This program is offered by the state. In New York is EPIC, EPIC, and it's actually a supplement to the drug program. It helps pay for the drugs. It's I encourage you to go and Google it, EPIC, and get the details, because it has 2 levels and it's income eligible. So if you are single and $75,000, you are eligible to enroll in this program as long as you are a New York State resident, you're 65 years old, and you have Part D, the drug part plan. For a couple is $100,000 per year income. So that is, if you qualify, it's a wonderful program. In New York, if you have this, if you are a member, which is free, by the way, you can use it to change your Medicare benefits program one more time besides the open enrollment period, which is October 15th to December 7th. So if you somewhere along the line in March, May, April, June, whatever, decide that the plan you're using is not working, and if you are a member of EPIC, you can use this EPIC membership to change your Medicare benefits.
Okay.
Couple of things that are new for 2024, and that is your Medicare enrollment is, if you enroll 1 month in May, your benefit starts the next month. There are no co-pays, no deductibles for vaccines like shingles, whooping cough, which nowadays grandmothers are getting because of visiting their grandchildren. We know that in 2023, insulin started now co-pays at $35. For Part D in the catastrophic stage, for 2024, there will be no more co-pays. And a little bit about marketing. CMS is really have strict rules now about marketing. Their ads on television must be approved first before it's aired. They cannot just offer you anything, any products. It has to be for that particular zip code. So that's why you're hearing them say, call, give us our zip code, and we'll tell you whether you qualify or not. Before I forget, very important, Medicare Advantage plans, one of the best sellers they have is the gym membership. That everybody, silver sneakers, everybody wants silver sneakers. Additionally, Medigap, some Medigap plans are beginning to offer a gym membership as a sweetener. So unless otherwise you have questions, I'll be glad to help, Carol. I think those are the highlights of the Medicare program. I hope it helped.
Oh my goodness, Mary Ann, thank you so much for that great overview of Medicare and the various options that are available to us. I appreciate your time so much and providing the WeCare4 community and audience with your insights and perspective. I really did appreciate what you've done. For all those listening, for additional podcasts on other relevant topics, You can find them on Spotify, Apple Podcasts, YouTube, and in the WeCare4 website. And that's www.WeCare4.com, where you can also find all the other WeCare4 resources available to you as a registered WeCare4 member. It includes our job board and career center, marketplace, forum, news and articles. And don't forget to follow us on Facebook, X, LinkedIn, and Instagram, and subscribe to our podcast series. Thank you for listening.